Yeah, Zimbabwe is a typical African population with a very wide base of young people. Very few people above the age of 65, that is elderly persons. We have the majority of our population in the rural areas, particularly probably more than 70%, and a few people actually in the urban areas. Despite the fact that we are smiley people in Zimbabwe, we have got a big problem of TB and HIV in the country.
My name is Constance Manwa. I'm a patient from Zidiga's clinic here in Bulawayo, Zimbabwe. I've been treated for MDR TB when I was pregnant with my firstborn baby. That's when I was tested for HIV. I tested positive. I started losing weight before I started taking drugs. I lost strength. I was becoming very weak. I started deteriorating.
We have got very big problems in terms of TB in the country, and last year alone almost 30,000 people were notified as TB patients in the country. The epidemic in the country is actually driven by HIV, and we still have got big issues to tackle in the country.
The U.S. government has partnered with Zimbabwe's National TB Control Program and an organization called the Union to improve the quality and increase the availability of TB health services here in Zimbabwe.
USAID Zimbabwe has worked on TB since 2008, providing relief to hundreds and thousands of Zimbabweans.
USAID Zimbabwe provides training, equipment and motorbikes to improve the transportation of TB specimens, to improve the diagnosis of TB. USAID and the Union have partnered to support hospital laboratories with special equipment designed to diagnose all forms of TB, and they have trained healthcare workers to use the equipment. The US government has also assisted healthcare workers to prevent the spread of tuberculosis, which is highly contagious, within health facilities to patients, visitors, and healthcare workers. With proper equipment, TB can be diagnosed correctly at medical diagnostic centers, but rural communities were still waiting weeks or even months for their TB test results. USAID supports the Union's transport system for TB and HIV specimens. These riders for health each ride their motorbikes more than 1,000 kilometers a week over rough terrain to deliver TB lab test results to health facilities. While there, they collect new specimens and transport them back to the lab.
So in the advent of riders, it is more easier, and I see it more easier because people are now enjoying. If they see me come, they know everything is well, is going very well.
This transport system has dramatically reduced the time it takes to receive test results, down to 1 week in rural areas and 1 day in urban areas. It allows TB patients to start treatment earlier, recover more quickly, and not continue to spread TB. 70% of TB patients are also HIV positive. To improve the quality of care for TB and HIV patients, USAID is also supporting a TB HIV integrated care program.
For us in Zimbabwe, the integrated TB HIV care model is the practice that we have piloted and are now implementing, where we provide service which aims to deal with both conditions at the same time.
We have got a very strong partnership between the USAID, our local mission in Zimbabwe, the National TB Program under the Ministry of Health, and the Union. It's a very powerful partnership. It's a tripartite which has gone a long way in tackling the problem of TB in the country.
The TB program in our district is a very vibrant program. We are following the national guidelines, the HIV, TB collaborative services. When patients come, we screen them for TB routinely using the standard TB screening tool. All patients who test HIV positive are screened for TB, and all patients who are diagnosed with TB are also screened for HIV.
Just went so well, and I started gaining weight, started gaining strength, started gaining confidence, started feeling alive again.
Zimbabwe as a country has done so well in terms of accessing and making available medicines to TB patients. We have got medicines all available from the clinic levels to major hospitals in the country. You will find the TB medicines available. The same with medicines that treat HIV. You will find them from clinic level to central hospitals, big hospitals in the country. So that's a big achievement that the country has done.
When patients receive high-quality treatment, they get tested, receive their results, are provided with medication, and recover quickly so they can return to their families and their work.
I was successfully cured. My son is bouncing, he's 6 years old now. We are happy.